Hello and welcome to the Essential Guide to Common Conditions in Newborn Babies. If you are a new parent, you may have many questions and concerns about your baby's health and well-being. You may wonder if your baby is normal, if he or she is developing properly, and if you are doing everything right to take care of your precious bundle of joy. But don't worry, you are not alone. Many parents face the same challenges and uncertainties as you do. That's why we have created this guide to help you understand some of the common conditions that affect newborns and how to deal with them effectively. Did you know that babies are born with around 300 bones, but by the time they grow up, they will have only 206? That's because some of their bones fuse together as they mature. This is just one of the many amazing facts about newborns that you will learn in this guide. Number 1. Birth injuries. Birth injuries are physical traumas that occur during the birthing process, particularly in cases of prolonged or challenging labor or when the infant is notably large. These injuries can encompass various conditions, with some of the common occurrences being bruising or swelling of the head or face, bleeding beneath the scalp or skull, fracture of the collarbone or other skeletal elements, nerve damage or paralysis affecting the face, arm, or hand, oxygen deprivation leading to potential brain damage. While many birth injuries are minor and tend to heal rapidly without causing lasting effect, some can be severe, necessitating immediate medical attention. It's crucial for parents to be vigilant and seek medical help if they observe any of the following signs in their newborn: difficulty in breathing or feeding, seizures or convulsions, limpness or stiffness in the body, excessive crying or irritability, abnormal movements or posture, skin color appearing pale or blue, presence of fever or signs of infection. To minimize the risk of birth injuries, regular prenatal care is essential. Following the guidance of healthcare providers regarding preparation for labor and delivery is crucial. Discussions with a doctor about potential risks and benefits associated with different delivery methods, including vaginal birth, cesarean section, or assisted delivery with forceps or vacuum, can contribute significantly to informed decision-making. In cases where a birth injury has occurred, parents may experience a range of emotions, including fear, anger, or guilt. It's imperative to recognize that such incidents are not the fault of the parents. Birth injuries can transpire irrespective of one's parenting skills or capabilities and are rather unfortunate, unforeseeable events. The paramount focus should be on the baby's recovery and well-being, and seeking support from family, friends, or professionals becomes crucial during such challenging times. Number 2. Jaundice. Jaundice, characterized by a yellowish tint in the skin and eyes, manifests when there's an excess of bilirubin in the bloodstream, a waste product resulting from the breakdown of red blood cells. Typically, the liver filters out bilirubin and excretes it through bile. However, in newborns whose livers are still developing, this process may be inefficient, leading to jaundice. This condition is prevalent among newborns, affecting approximately 60% of full-term babies and 80% of premature infants. Typically appearing within the first week of life, jaundice is generally harmless and tends to resolve on its own within 2 to 3 weeks. While often benign, jaundice can, in certain instances, signal more serious underlying issues such as infection or sepsis, blood type incompatibility between the mother and the baby, hemolytic disease of the newborn, liver disease or disorder, metabolic disorder or enzyme deficiency, genetic disorder or syndrome. Severe or persistent jaundice lasting beyond 3 weeks poses a risk of complications like brain damage or kernicterus, potentially leading to permanent neurological problems such as cerebral palsy, hearing loss, or learning disabilities. Monitoring your baby for signs of worsening jaundice is crucial, and medical attention should be sought if any of the following indicators arise: yellow color spreading to the chest, abdomen, arms, or legs, deepening or intensification of the yellow color, sleepiness, lethargy, or difficulty waking up, fussiness, irritability, or inconsolability, poor feeding or inadequate weight gain, dark urine or pale stools, fever or other signs of infection. The treatment for jaundice hinges on its cause and the bilirubin levels. Phototherapy, a common approach, involves exposing the baby to special blue light, aiding in bilirubin breakdown for easier elimination by the liver. Depending on the baby's condition, phototherapy can be administered in the hospital or at home as advised by the doctor. In extreme cases of severe jaundice unresponsive to other treatments, exchange transfusion may be considered. This involves replacing the baby's blood with fresh blood containing a normal bilirubin level. However, this procedure is rare and carries inherent risks. Preventing jaundice involves ensuring your baby is adequately fed with either breast milk or formula. Regular feeding stimulates bowel movements, aiding in bilirubin elimination. Additionally, keeping the baby well hydrated and avoiding direct sunlight exposure can contribute to mitigating the severity of jaundice. Number 3. Colic. Colic, a term that strikes fear into the hearts of many new parents, refers to the phenomenon of excessive and inconsolable crying in an otherwise healthy baby. Typically emerging around 2 to 4 weeks of age, colic tends to persist until the baby reaches 3 to 4 months of age. The hallmark characteristics include crying episodes lasting more than 3 hours a day, occurring more than 3 days a week, for a duration exceeding 3 weeks. The precise cause of colic remains elusive, adding to the challenge for parents. Several potential factors are often considered: gas or indigestion, hormonal changes or stress, overstimulation or sensitivity to noise or light, immature nervous system or brain, allergy or intolerance to milk or other foods, reflux or gastroesophageal reflux disease GERD. While colic itself is not harmful or dangerous to the baby's physical health, it can be emotionally distressing and physically exhausting for parents. Unfortunately, there is no magic cure for colic, but parents can explore various strategies to soothe their baby and enhance their comfort. Some recommendations include burping the baby after every feeding and maintaining an optimal feeding volume, experimenting with different feeding positions, bottles, or nipples, considering a switch to hypoallergenic or lactose-free formula, or eliminating potential allergens from the breastfeeding parent's diet, gently massaging the baby's abdomen or back or applying a warm compress, holding or rocking the baby in a gentle manner or utilizing a sling or carrier, engaging in soothing activities like singing, humming, playing calming music, or using white noise, swaddling the baby snugly or offering a pacifier, providing a warm bath or a gentle rub-down, exploring the use of infant probiotics or cytokine drops to alleviate gas or aid digestion, consulting with a doctor regarding herbal remedies or medications such as chamomile tea or antacids. Crucially, parents must also prioritize self-care and seek support from their partner, family, friends, or professionals if they find themselves overwhelmed or experiencing depressive feelings due to their baby's colic. It's essential to remember that colic is not a reflection of parental abilities, and with time, it will eventually pass. Number 4. Abdominal distension. Abdominal distension, characterized by a swollen and firm belly, particularly after feeding, is a prevalent condition affecting approximately 10% of newborns. While often attributed to common causes such as gas or constipation, it can also serve as an indicator of more serious underlying issues, including intestinal obstruction or blockage, Hirschsprung's disease involving a lack of nerve cells in the colon, necrotizing enterocolitis characterized by inflammation and infection of the intestines, pyloric stenosis indicating narrowing of the opening between the stomach and the small intestine, volvulus denoting the twisting of the intestines, hernia presenting as the protrusion of an organ through a weak spot in the abdominal wall. The manifestation of abdominal distension may bring about discomfort, pain, vomiting, diarrhea, or even bloody stools in the baby. If parents observe any of these symptoms, or if the abdominal distension persists or becomes severe, seeking prompt medical attention from a doctor is crucial. The approach to treating abdominal distension hinges on identifying and addressing the underlying cause. For mild cases related to gas or constipation, some home remedies might be attempted, including encouraging the consumption of ample fluids and incorporating high-fiber foods into the baby's diet, utilizing over-the-counter medications like cytokine, laxatives, or stool softeners, employing gentle massage on the baby's belly or engaging in leg movements resembling a bicycle motion, trying rectal stimulation using a lubricated cotton swab or a rectal thermometer to prompt a bowel movement, Applying a warm compress or heating pad to the abdomen. In instances of more serious abdominal distension, medical intervention becomes imperative. Doctors may prescribe medications such as antibiotics, anti-inflammatory drugs, or antispasmodics to address the underlying condition. Surgery might be deemed necessary in certain cases to eliminate obstructions, repair hernias, or correct anatomical defects. Prevention of abdominal distension is centered around proper and regular feeding practices for the baby. Avoiding foods that could potentially cause gas or allergies is advisable. Additionally, parents should diligently monitor their baby's bowel movements and urine output, promptly reporting any changes or abnormalities to their healthcare provider. Number 5. Diaper rash. Diaper rash, a common skin irritation in the diaper area, is frequently a result of prolonged contact with urine or feces and friction from the diaper. It affects up to 50% of babies at some point, manifesting as redness, swelling, warmth, tenderness, and in severe cases, blisters, sores, or pus. Additionally, it can cause discomfort for the baby, leading to fussiness or restlessness. Complications may arise when diaper rash is accompanied by a fungal or bacterial infection, such as candidiasis or impetigo, exacerbating the rash and potentially spreading to other areas of the body. The primary approach to managing diaper rash involves maintaining a clean and dry diaper area while protecting the skin from further irritation. This can be achieved through the following measures. Changing the baby's diaper frequently, especially when wet or soiled. Gently cleaning the diaper area with water, a soft cloth, or mild soap, and patting it dry. Applying a thick layer of barrier cream or ointment, e.g. zinc oxide or petroleum jelly, to the affected area. Avoiding wipes, powders, or perfume products that may irritate the skin. Choosing breathable, disposable diapers or well-fitted cloth diapers washed with mild detergent. Allowing the baby's diaper area to be exposed to air or using a fan or hair dryer on a low setting to facilitate drying. Giving the baby a soothing bath with baking soda or oatmeal. If the diaper rash persists or worsens, especially in severe cases, consulting a doctor is advisable. The doctor may prescribe topical or oral medications such as antifungals, antibiotics, or steroids to address infection or inflammation. Preventing diaper rash involves following similar steps as those in the treatment regimen. Additionally, it's crucial to be mindful of potential triggers such as introducing new diapers, wipes, or detergents, incorporating foods or drinks that may lead to diarrhea or allergies like citrus fruits, juices, or dairy products, administering antibiotics or other medications that could disrupt the balance of bacteria in the gut, managing teething or illnesses that might increase the acidity of urine or feces. By adhering to these preventive measures and promptly addressing any signs of diaper rash, parents can help keep their baby's delicate skin healthy and comfortable. Number 6. Cradle cap. Cradle cap, a common skin condition affecting the scalps of newborns and infants, is recognizable by its yellowish, greasy, scaly patches or crusts that can cover parts or the entirety of the scalp. In some cases, it may extend to other areas of the body like the eyebrows, eyelids, ears, nose, or chest. While cradle cap is neither contagious, itchy, nor painful and has no impact on a baby's growth or development, it can be a source of concern for parents due to its unsightly appearance. Fortunately, this condition is typically harmless and tends to resolve on its own within a few weeks or months. The precise cause of cradle cap remains unknown, but several factors may contribute to its development, including overproduction of sebum or oil by the sebaceous glands in the skin, overgrowth of a yeast or fungus called malassezia that resides on the skin, inflammation or irritation of the skin, hormonal changes or genetic factors. Management of cradle cap involves gentle removal of scales or crusts along with moisturizing the scalp. Parents can follow these steps. Wash the baby's scalp with a mild shampoo once a day or every other day, ensuring thorough rinsing. Soften the scales or crust with mineral oil, olive oil, or petroleum jelly, leaving it on for a few hours or overnight. Loosen the scales or crust with a soft brush, comb, or cloth, gently lifting them off. Apply a moisturizer or hydrocortisone cream to the scalp after washing. Avoid scratching, picking, or rubbing the scalp to prevent potential bleeding or infection. In cases where a cradle cap is severe or doesn't respond to home treatments, consulting a doctor is advisable. The doctor may prescribe a medicated shampoo, lotion, or cream, such as antifungals, antibiotics, or keratolytics to address underlying causes or complications. Preventing cradle cap involves maintaining a clean and moisturized scalp for the baby and avoiding harsh or irritating products, such as those containing alcohol, perfumes, or dyes. By adhering to these preventive measures, parents can help ensure the well-being of their baby's delicate skin. Number 7. Thrush. Thrush, a fungal infection affecting the mouth and throat of newborns and infants, is caused by Candida albicans, a yeast or fungus that naturally resides in various parts of the body without causing issues. However, disturbances in the balance of bacteria and fungi can lead to the overgrowth of Candida, resulting in thrush. Thrush manifests as white or yellow patches or spots on the tongue, gums, cheeks, roof of the mouth, or throat, resembling cottage cheese or milk curds. Additionally, it may cause redness, soreness, bleeding in the mouth or throat, and difficulties with feeding or swallowing. During breastfeeding, the infection can be transmitted from the baby to the mother's nipples, causing pain, itching, or cracking. Treatment involves the use of antifungal medications like nystatin, fluconazole, or miconazole to eliminate Candida and clear the infection. The medication can be administered as a liquid, gel, or tablet post-feeding, and the mouth should not be rinsed or wiped afterward. The treatment duration typically spans 1 to 2 weeks. In cases where the mother is breastfeeding, she should also use an antifungal cream or ointment on her nipples and maintain proper hygiene. This includes washing hands and breasts before and after feeding and sterilizing or replacing items that come in contact with the baby's mouth, such as pacifiers, bottles, or toys to prevent reinfection. Preventing thrush involves maintaining good oral hygiene and health and avoiding factors that increase the risk of infection, such as use of antibiotics or steroids, which may reduce the natural defenses of the mouth. Presence of diabetes or immune system disorders that can impair the ability to fight infections. Poor nutrition or dehydration affecting saliva production and the pH of the mouth. Smoking or exposure to secondhand smoke causing irritation to the mouth and throat. Thank you for joining us on this insightful journey through common conditions in newborn babies. We hope you found the information helpful and reassuring. Your baby's well-being is our priority, and understanding these conditions is a crucial step in providing the best care. If you enjoyed this guide, don't forget to hit the like button and subscribe to our channel. Your support means the world to us, and it helps us create more content to assist you on your parenting journey.